Welcome back everyone. In today's lesson we'll see about kangaroo mother care, its definition, benefits, eligibility and discharge from kangaroo mother care. Kangaroo mother care is a special way of caring of low birth weight babies. It fosters their health and well-being by promoting effective thermal control, breastfeeding, infection prevention and bonding. Kangaroo mother care is initiated in the hospital and continued at home. The two components of kangaroo mother care are skin-to-skin contact and exclusive breastfeeding. Early, continuous, prolonged skin-to-skin contact between the mother and her baby is the basic component of KMC. The infant is placed on her mother's chest between the breasts, and the baby on KMC is breastfed exclusively. And skin-to-skin contact promotes lactation and facilitates the feeding interaction. When we see benefits of kangaroo mother care, the first is for breastfeeding. Studies have revealed that KMC results in increased breastfeeding rates as well as increased duration of breastfeeding. The other is for thermal control. Prolonged skin-to-skin contact between the mother and her preterm or low birth weight infant provides effective thermal control with a reduced risk of hypothermia. For stable babies, KMC is at least equivalent to conventional care with incubators in terms of safety and thermal protection. The other is for early discharge. Studies have shown that KMC cared low birth weight infants could be discharged from the hospital earlier than the conventionally managed babies. The babies gained more weight on KMC than on conventional care, so it promotes early discharge from the hospital. Babies receiving KMC have more regular breathing and less predisposition to apnea. KMC protects against nosocomial infection, and also overall KMC provides the way to reduce morbidity for premature and low birth weight infants. The other effects of KMC include it benefits both the infants and the parents. Mothers are less stressed during kangaroo mother care as compared with baby kept in incubator. Mothers prefer skin-to-skin contact to conventional care. They report a strong bonding with the baby, increased confidence and a deep satisfaction that they were able to do something special for their babies. Even fathers felt more relaxed, comfortable and better bonded while providing kangaroo mother care. When we see the eligibility criteria for KMC, we should have to see both the babies and the mother's condition to put them under KMC. On the baby side, overall all stable, low burn weight and premature babies are eligible for KMC. However, very sick babies needing special care should be cared under radiant hormone initially, and KMC should be started after the baby is hemodynamically stable. Overall guidelines for practicing KMC include for those birth weight greater than 1.8 kg or greater than 1,800 gram. Those babies are generally stable at birth because since they are late preterm, therefore most of their KMC they can be initiated soon after birth. If their birth weight is between 1.2 to 1.8 kg, many babies of this group have significant problems in neonatal period, so it may take a few days before KMC can be initiated. For those birth weight less than 1.2 kg, frequently those babies develop a serious premature-related morbidity after starting soon after birth, so it may take days to weeks before baby's condition allow initiation of KMC. On the mother side, all mothers can provide KMC irrespective of age, parity, education, culture, and religion, but the following points must be taken into consideration when counseling on KMC. The first is willingness. Health care providers should counsel and motivate the mother. The other is general health and nutrition. The mother should be free from serious illness to be able to provide KMC. The other is hygiene and supportive family. Apart from supporting the mother, family members should also be encouraged to provide KMC when the mother wishes to take rest. Kangaroo positioning includes the baby should be placed between the mother's breast in an upright position, and the head should be turned to one side and in a slightly extended position, because this slightly extended head position keeps the airway open and allows eye-to-eye contact between the mother and her baby. And the hips should be flexed and abducted in a frog position, and the arms should also be flexed. Baby's abdomen should be at the level of the mother's epigastrium, and the mother's breathing stimulates the babies, so thus reducing the occurrence of apnea. And support the baby's bottom with a sling or binder is needed. Always we should have to monitor both the healthcare worker and the mother. We should have to ensure that the baby's neck is not too flexed or too extended. Breathing is normal and feet and hands are well. Regarding feeding, the mothers should be explained how to breastfeed while the baby is in KMC positioning and hold the baby near the breast because it stimulates milk production. And she might express milk while the baby is still in KMC position, and the baby could be fed direct with spoon or with energy tube depending on the condition of the baby. Regarding duration of KMC, skin to skin contact should start gradually in the nursery with smooth transition from conventional care to continuous KMC. Sessions that last less than 1 hour should be avoided because frequent handling might be stressful for the baby. The length of skin to skin contact should be gradually increased up to 24 hours a day, interrupted only for changing diapers. When the baby does not require intensive care, she should be transferred to the postnatal ward where KMC should be continued. Generally, the following criteria is accepted at most centers to send from hospital to continuous KMC at home. Those are: baby's general health is good and no evidence of infection, feeding is well and receiving exclusively or predominantly breast milk, gaining weight at least 15 to 20 grams per kg per day for at least 3 consecutive days, maintaining body temperature satisfactorily for at least 3 consecutive days in room temperature, and the mothers and family members are confident to take care of the baby in KMC and should be asked to come for follow-up visits regularly. The last one is discharge from KMC. When the mother and the baby are comfortable, KMC is continued for as long as possible, at the institution and then at home. Often, discharge from KMC is desirable until the baby's gestation reaches term or the weight is around 2.5 kg. She starts wriggling to show that she's uncomfortable, pulls her limbs out, cries and refuses every time the mother tries to put her back in skin-to-skin contact. So this is the time to wean the baby from KMC. Mothers can provide skin-to-skin contact occasionally after giving the baby a bath and during a cold night after the discharge from KMC. This is all about Kangaroo Mother Care. Thank you for watching.